Yeah. Well, of course, WHO will be ideally, we would like to see an immediate transition to clean sources of energy, renewable, non-pollutant. But we recognize as well that there has to be a transition, and particularly for those most vulnerable that are now using very polluting sources. That transition through better sources of energy will include access to LPG, for instance, biogas and ethanol, even if, of course, they are not considered the ideal one, the renewable ones, the green ones, but they can ensure a transition while protecting the health of the people. So access to LPG and programs like what is happening in India to promote access at the household level to LPG sources, we consider that as a transition. Hopefully, then the next step will be even more ambitious. But those interventions, if there is financial support for those households, I think it can ensure very good health benefits for our population, and particularly the most vulnerable. But obviously, we need to build on the local capacity and making sure that the finance will be available. I think we need to recognize that India has been a very good pioneer in terms of proposing this program for access to LPG and then providing some subsidies and increasing that. But of course, the effort has to be not only maintained, but probably scale up. As you say, there are still a big percentage of households in India that they are not having access to proper or not pollutant sources of energy, and resulting, of course, in mortality and morbidity, which is extremely important. We will call to the government to keep on that effort, on that leadership that they showed when they put the program in place, and accelerate and scale up, because it has demonstrated the good results when it's implemented. So from a health point of view, we will definitely stimulate the government to go for much more and to maintain that program and ensure access to these sources of household energy for those very vulnerable people who at the moment they are not having it yet. The benefits will for health, of course, but I think we can see as well a lot of economic benefits for those families, and at the same time you will see as well educational benefits of girls being able to go to school and others. So the win-win on this type of programs are absolutely phenomenal. Well, there is a study that has been published today on the Lancet Planetary Health. I don't know whether you saw it this morning, where it says that it's true that we always put the focus on New Delhi, but I'm afraid it's almost the entire India where WHO standards are not implemented, which is very much the case in almost every country around the world. But one thing is to distanciate a little bit from WHO, exceed a little bit WHO standards, and another thing is going really beyond and on a very high, very much distant from what are the recommendations of WHO. And we think that clearly air pollution is a public health issue in India that needs to be addressed with more political engagement and definitely accelerating the actions that have been taken until now. We think as well that in India you have incredible experts and scientists that are already addressing that, and as well policymakers and responsible people that are genuinely very much concerned about that. So the message to India is you just need to accelerate action, and you need to somehow take this as a key public health priority, because the results will be very positive. Yeah, as you know, there will be, even at the General Assembly this year in September in New York, there will be a resolution at a high level, one on non-communicable diseases. And I think this year, finally, we will have a very strong integration of air pollution as one of the key risk factors for NCDs. We need to make sure that the NCDs community understand that by tackling air pollution, we are contributing enormously to reduce the burden of NCDs, and the other way around, that we need their support, the non-communicable diseases groups, Alliance, and others, incorporating air pollution as one of the key risk factors on their agenda. So this will require, obviously, to work with the energy sector, of course, on making sure that air pollution is included on the goals of NCDs and the prevention programs, and the data and technical guidance to evaluate the results and all of that. But I think is definitely extremely important, and the recognition of air pollution as a risk factor for NCDs is now very much on the political agenda, and hopefully this will represent a substantial increase on the attention that they are giving to air pollution. And the other way around, air pollution community, we will make sure that we will collect the benefits on NCDs and use that to generate more action. Well, I think I would like to see India in terms of air pollution, instead of being on the headlines of the newspaper as in red. I think the opportunity is there to start to lead and put in place very innovative solutions, technologies, the expertise that the country can put together, and graphics, those graphics where we start to see this the decrease on the air pollution and how the economy goes up. So a lot of hope, of course, concern about the situation, but a lot of hope because knowing the experts in India and what you can achieve when you have a good political commitment and decision. A country like India cannot be on the headlines in red on an issue like this one. At the contrary, it has to be very much on the headlines as the champion on fighting air pollution and providing cleaner air to their population.